Sitting of the Senate. It's your pleasure, honorable senators, to adopt the motion. Adopted, carried.
Numéro 2, deuxième lecture.
Number 2, second reading of Bill C-45.
Honourable Senators, I move that this bill be read a second time.
It is moved by the honorable Senator Dean, seconded by the honorable Senator Faure, that this bill be read a second time. On debate, Senator Dean.
Thank you, Your Honour. Honourable Senators, it's my pleasure to rise in this chamber as sponsor of Bill C-45, an act respecting cannabis, and to amend Controlled Drugs and Substances Act, the Criminal Code and other acts, also known as the Cannabis Act. This bill is both significant and historic in the context of health promotion in Canada. In that sense, to ensure there were no surprises, I last night offered to share this statement with critics and with leaders where there are no critics assigned. And I'm happy to say that in most cases that offer was taken up. The issue of legalisation and regulation of cannabis is not new to this chamber. It's an issue that was studied 15 years ago in 2002 by the Senate Special Committee on Illegal Drugs. The study was chaired by the highly respected, late Senator Pierre-Claude Nolan, a Conservative senator and former Speaker who was highly regarded in this place and I know is sadly missed. Senator Nolan's study was prescient on cannabis reform and in fact of the conclusions of the 2016 Task Force on Cannabis Legalisation. His striking conclusion then in 2002 mirrored what policy, medical and community health specialists are saying today, that continuing to criminalise cannabis is more harmful to young Canadians than legalising it and regulating it. This was Senator Nolan's advice to us. Bill C-45 is directly responsive to Pierre-Claude Nolan's appeal to us in 2002. Before I proceed, I want to acknowledge the efforts of the Minister of Justice, who introduced Bill C-45 in the other chamber, and her colleagues, the Minister of Health and Minister of Public Safety and Emergency Preparedness, all of whom have responsibility over important aspects of this bill. I'd also like to thank the members of the House Standing Committee on Health, who reviewed 115 briefs and heard from over 100 witnesses, and through their work adopted several amendments to strengthen the bill. And I also want to thank Canada's top-rate professional public servants for their hard work in this challenging area of public health. Thanks also to my two staff, Amanda McLaren and Lauren Thomas, who work in my office, for working so hard to get as much advance information and research into the hands of every senator well in advance of today. And we all thank them for that. I suggest we approach Bill C-45 in three ways. I come from the world of policy, non-partisan public administration, and I'm guided by that as I do my work as sponsor in this place. First, making an effort to understand the nature of the problem the government is trying to address, looking closely at the evidence. Second, understanding the government's desired goals and outcomes, which are reducing the harms of cannabis use in Canada and disrupting the country's massive $7 billion illicit cannabis market, with all of this being considered through the lens of community health and harm reduction. Third, and importantly, is our task of looking at the government's proposed means of addressing the harms of cannabis. And here we're talking about the demonstrated harms to health, and especially the health of young Canadians, as well as the potentially lifelong harms associated with criminalising a drug which at a population level is less harmful than alcohol or tobacco. I'll start by reviewing the context in which Bill C-45 has been developed. So let's take a look at the consumption patterns and harms of cannabis, because I know this is something that we're all deeply interested in. Canadians, and particularly young Canadians, continue to use cannabis at some of the highest rates in the world. According to the 2015 Canadian Tobacco, Alcohol and Drugs Survey, the prevalence of past-year cannabis use was 21% among young people aged 15 to 19, just under 30% among young adults aged 20 to 24, and 10% among adults over the age of 25. And we know that the impacts of substance abuse on young people is greater in many Indigenous communities. The evidence is clear that young Canadians are currently consuming cannabis at alarming rates. We hear from young people that it's easier for kids to buy cannabis than cigarettes. It sure looks that way in my neighbourhood. I don't know about yours. But I watch high school kids go into school in the morning smoking cannabis. I see them smoking cannabis coming home at night. I go for a run in Hyde Park. I smell cannabis. A car passes me with its windows open. I smell cannabis. People are using cannabis in driving today. Large numbers of young people are using cannabis today. And the harms associated with cannabis are considerable. Health Canada, in its April 2017 publication, The Health Effects of Cannabis, is uncompromising about the harms of cannabis on users. Some of the short-term effects of cannabis use on the brain can include confusion, fatigue, impaired memory and concentration, anxiety, sometimes fear, panic, even delusions and hallucinations. Long-term effects of cannabis on the brain can include an increased risk of addiction, impairment to memory, concentration, intelligence, as well as impairment of one's ability to think and make decisions. These risks of harm are well documented and have well documented implications for school performance and decision-making on important life decisions that have long-term consequences. These risks increase the younger a person is when they start using cannabis, and the more often they use it, and the more intensely they use it. There is evidence that frequent and heavy use of cannabis can affect brain development in children and adolescents. Like alcohol, like cigarettes, cannabis can be addictive, and early consumption is a risk factor for this. The risk of dependence jumps from 9% in cases of regular users of cannabis to 16% of regular users who initiated use during adolescence. The relationship between cannabis use and impaired driving is obviously also a concern, and it's magnified where cannabis is consumed together with alcohol. This, of course, is the focus of Bill 46. Finally, there are considerable safety concerns associated with the illicit cannabis market, which in Canada alone is estimated to contribute upwards of $7 billion income annually, reportedly in large part for organised crime. The potency of illicit cannabis is often unknown and could result in heightened or prolonged harms such as confusion or anxiety. Furthermore, the quality, content and purity of illicit cannabis has no safeguards. It may contain pesticides, other drugs, heavy metals, molds or fungi, or other contaminants. Today, I'm talking about today. Beyond the health risks associated with cannabis, the criminalisation of this drug results in tens of thousands of criminal records each year, which can have long-term consequences for Canadians, including stigmatisation, marginalisation, and restricted employment opportunities. Criminalisation of cannabis has also contributed significantly to high costs and backlogs in the criminal justice system. More than half of all reported drug offences are cannabis-related. In 2016, this amounted to nearly 55,000 offences reported to police. The majority of these offences, 81%, were possession offences. This resulted in approximately 23,000 cannabis-related charges being laid, with 76% of them being related to cannabis possession. The maximum penalty for simple possession on indictment is 5 years less a day. We also know that criminalisation can disproportionately affect Indigenous and other racialised Canadians, groups already overrepresented in our prisons. In 2015-16, Indigenous youth accounted for 7.5% of the overall Canadian population, but made up 39% of admissions to youth custody. Honourable Senators, the status quo is not working to protect the health and wellness of Canadians, and especially young Canadians. In 2002, Senator Nolan concluded that the long-term criminalisation of cannabis has been a failure, just as the Ledane Commission had concluded 30 years before in 1972. Senator Nolan observed that in the years between 1972 and 2002, between those two studies, billions of dollars had been sunk into enforcement without any great effect. The consumption of cannabis just continued to grow. And here we are 15 years after Senator Nolan's report, still looking at the highest rate of cannabis young users in Canada being reflected as some of those that are among the highest in the world. Honourable Senators, we've all looked the other way too long, relying on tough-on-crime policies that actually discourage public education, community health initiatives, and harm reduction programs. We need more programs that acknowledge the realities of substance abuse and that offer sensible information to inform risk-informed decision-making. We simply have to do a better job in tackling the harms of cannabis. Bill C-45 proposes a cautious, balanced approach to the legalisation and regulation of cannabis through a public health-based lens and with a focus on prevention and harm reduction. There's another side to cannabis that I want to touch on, because we'll hear about this in committee inevitably, and this relates to its therapeutic uses. Looking again at a January 2017 report, the health effects of cannabis and cannabinoids, the current state of evidence and recommendations for research, from a US-based ad hoc committee of the National Academies of Sciences, Engineering and Medicine, concludes, among other things, that there is substantial evidence that cannabis or cannabinoids are effective for the treatment of chronic pain in adults, for the treatment of chemotherapy-induced nausea and vomiting, and for improved patient-reported multiple sclerosis spasticity symptoms. There is moderate evidence that cannabis or cannabinoids are effective for improving short-term sleep outcomes in individuals with sleep disturbance associated with obstructive sleep apnea, fibromyalgia, chronic pain, and multiple sclerosis. There's also some evidence to suggest that cannabis or cannabinoids may be effective in treating other issues, including increasing appetite and decreasing weight loss associated with HIV/AIDS, and improving symptoms of Tourette syndrome, anxiety, and post-traumatic stress disorder. I imagine that there are a few of us in this place who don't know somebody who's using medicinal cannabis to treat one of these disorders today. Now, Honourable Senators, on that note, Canada already has a well-established medicinal cannabis regime, which will significantly inform the way forward in implementing non-medical cannabis reform. This isn't a cold start. This is not a cold start. It's not starting in July of 2018. It's not a cold start. Canada already has a well-established medical cannabis regime. Countries around the globe, including Australia, European countries, Uruguay, US states, are looking closely at Canada's robust existing production and successful distribution system for medicinal cannabis. We currently have 76 licensed medical cannabis producers in Canada. I visited one of them, serving over 235,000 licensed medical patients. Some Canadian producers are entering into supply contracts with governments in Germany and Australia. Canada is a world leader in medical cannabis production. a world leader, a recognized leader. So developing a legal regime in Canada is not a cold start, although some might wish to think so. But returning to our challenge, we know that illicit cannabis is widely available and frequently used by young people in Canada today. We know this is done in an entirely unregulated $7 billion market in which cannabis is not tested for contaminants or tested for potency. This is the situation today in Canada. And this was the backdrop to the government's commitment in the 2015 speech from the throne to legalise, regulate and restrict access to cannabis. This commitment recognised that Canada's existing prohibitionist approach towards cannabis is not working, that it's time to stop looking the other way and start wrapping our arms around a serious public health challenge in this country. Honourable Senators, I believe that Bill C-45 proposes a cautious, balanced approach in legalising and regulating cannabis. Many Canadians no longer believe that simple possession of small amounts of cannabis should be subject to harsh criminal sanctions, and the government has in Bill C-45 proposed a better, balanced approach, one which is grounded in public health and public safety. Honourable Senators, it's important for us to understand how this issue has evolved over the years. The proposal of a new framework for legalising and strictly regulating cannabis is not an out-of-the-blue initiative. Consideration of Canada's domestic cannabis policy has been ongoing for decades. Cannabis was first prohibited in Canada in 1923 when it was added to the Opium and Narcotic Drug Act by the Minister of Health without much, or if any, explanation. Hasn't been a good explanation provided since, if we're going to be honest about it. There have been other parliamentary reviews over almost a half century that have considered questions regarding cannabis law reform in Canada. Notably, in the early 1970s, the Commission of Inquiry into the Non-Medical Use of Drugs, the Ledane Commission. And in 2002, the Senate Special Committee on Illegal Drugs that I've already mentioned. From 1969 to 1972, the Ledane Commission considered the very issues that we are discussing today. Its majority recommendations included the repeal of the prohibition against the simple possession of cannabis and cultivation for personal use, while the minority view recommended a policy of legal distribution of cannabis, the removal of cannabis from the Narcotic Control Act, and implementation of provincial controls on possession and cultivation similar to those governing the use of alcohol. In 2002, the Special Senate Committee on Illegal Drugs determined that criminalising cannabis possession is more harmful to young Canadians than legalising and regulating it. In 2014, the Centre for Addiction and Mental Health, the largest mental health and addiction treatment centre in Canada, recommended the legalisation and regulation of cannabis. That was in 2014. And most recently, the 2016 report of the Task Force on Cannabis Legalisation and Regulation, chaired by the Honourable Anne McClellan, was informed by a broad consultation and study of cannabis. In addition to hosting a series of roundtable discussions in cities across the country to engage with experts from a wide spectrum of disciplines, the task force received nearly 30,000 submissions from Canadians and considered close to 300 comprehensive written submissions. The task force heard directly from professionals, employers, frontline workers, cannabis-using medical patients, employers, Indigenous stakeholders, governments and organisations. The task force also held an Indigenous roundtable in October 2016 that included elders, the Assembly of First Nations, the Métis National Council and the Congress of Aboriginal Peoples. Indigenous groups also participated in regional roundtables in British Columbia, Alberta, Ontario, Nova Scotia, and a bilateral meeting was held with the Inuit Tepirit Kanatami. The views of these groups consulted were reflected in the report, including the need to engage Indigenous communities and elders in the design and delivery of public education and awareness activities, and to explore opportunities for participation in the legal cannabis industry. The task force also conducted site visits to Colorado, Washington, two states that have recently legalised cannabis for non-medical purposes, where they were briefed by state officials. The task force also spoke with senior officials from the government of Uruguay about their unique experience as the only country to date to have enacted a regulatory system for legal access to cannabis. They visited the facilities of licensed producers on both sides of the border in order to familiarise themselves with the regulated cannabis production industry. Honourable Senators, the December 2006 final report of the task force has been very well received. It is evidence-informed, it's comprehensive, it provides readers with a solid grounding in the pertinent considerations related to the legalisation and strict regulation of non-medical cannabis. And now we turn to the Cannabis Act, which is largely aligned with the recommendations of the 2016 task force. Bill C-45 would create a legal framework where adults can access legal cannabis through an appropriate retail framework sourced from a well-regulated industry or grown in limited amounts at home. Adults 18 years or older would be permitted to legally possess 30 grams of legal dried cannabis or its equivalent for different classes of cannabis while in public. Adults could also legally share up to 30 grams of legal dried cannabis or its equivalent with other adults. Selling or possessing to sell would only be lawful if authorised under the Act. One thing is perfectly clear. There would be strict prohibition on cannabis being sold or given to a young person. The Act creates a new serious criminal offence to sell or for adults to give cannabis to a young person. The Act also proposes a new serious criminal offence to use or involve a young person in the commission of a cannabis offence. Possession, production, distribution, import, export, sale outside of the legal framework would remain illegal and be subject to criminal penalties proportionate to the seriousness of the offence. Importantly, the penalties in Bill C-45 are significantly different from the current Controlled Drugs and Substances Act, the CDSA. First, the offences proposed in Bill C-45 would now be hybrid as opposed to strictly indictable, without any mandatory minimum penalties. Second, Bill C-45 would provide a range of penalties, from ticketing for adults who commit minor possession or personal production offences to a maximum of 14 years imprisonment for more serious offences. Bill C-45 would also exempt from criminal prosecution young people who possess or share very small amounts of cannabis up to 5 grams, while young persons who possess or distribute more than 5 grams would be subject to an offence and dealt with under the provisions of the Youth Criminal Justice Act, which emphasises community-based responses, rehabilitation and reintegration as opposed to criminalisation. For serious offences, alternatives to charging are encouraged, such as taking no further action, warning the young person or referring them to a community program or agency to help address the circumstances underlying their behaviour. Honourable Senators, significant discussion has occurred in relation to the treatment of young persons under Bill C-45. And I would like to take some time now to set out how the government's proposed approach will focus on young people. There have been concerns raised in relation to the exemption of young persons from criminal prosecution for possession up to 5 grams of cannabis, and suggestions that this decision is sending the wrong message to young people. It should be noted, however, that Bill C-45 aligns with the task force view that the ongoing criminalisation of youth for possessing or sharing very small amounts of cannabis would do more harm than good. That criminalisation would do more harm than good. It's also important to note that the federal government has been regularly engaging with the provinces and territories for the last couple of years, in fact, as they develop their own implementation plans, and thus far, provinces led by Canada's largest province, Ontario, and Alberta, are opting to use the latitude provided by Bill C-45 to create provincial or territorial offences that would prohibit young people under 18 or 19 from possessing any amount of cannabis. The provinces are using the latitude given to them in Bill 45 to eliminate the 5-gram allowance. This approach would provide police with the authority to seize cannabis from young people, while at the same time not render them liable to criminal sanctions that could negatively impact their future. This approach would be complemented by the other protections in Bill C-45, which would serve to protect our young people by restricting youth access to cannabis, protecting young people from promotional enticements to use cannabis, prohibiting products that are appealing to young people, prohibiting the packaging or labelling of cannabis in a way that makes it appealing to youth, prohibiting the sale of cannabis through self-service displays or vending machines, and creating these new offences with significant penalties for adults who either sell or distribute cannabis to young people or who would use a young person to commit a cannabis-related offence. Outside of the legislation itself, the government is investing $45.6 million over 5 years in a robust public education campaign to educate Canadians, and particularly young Canadians, about the risks and harms of cannabis use. In addition, the government has also been working in partnerships with organisations such as Drug Free Kids Canada, who are doing a magnificent job targeting youth in campaigns that have evolved away from just say no, something that we know hasn't worked. Their Cannabis Talk Kit that gives parents the information to have informed conversations with their teens about cannabis was recently distributed to schools, communities and doctors' offices across the country. I would also like to note that the Canadian Students for Sensible Drug Policy are currently working to develop an education and research campaign that priorities youth input. They sought out collaborators on cannabis education with the objective to develop meaningful tools for young people to access the education they deserve. I look forward to their upcoming cannabis curriculum. Under the proposed legislation, the federal, provincial and territorial governments would all share in the responsibility for overseeing the new system. Federal responsibilities would generally be to oversee the production and manufacturing components of the cannabis framework and set industry-wide rules and standards. In keeping with the recommendations of the task force, provinces and territories would generally be responsible for the distribution and sale components of the framework, and would of course be able to create further provincial restrictions as they see fit, including increasing the minimum age in their jurisdiction, which is happening, lowering the possession limit for cannabis, which is happening, which could be pursued to further protect youth, creating additional rules for growing cannabis at home, including the possibility of lowering the number of plants allowed per residence, which is happening, and restricting where cannabis can be consumed, such as in public or in vehicles, which is happening. And we know that provinces and territories are adopting a precautionary approach in applying these sorts of additional restrictions. In addition to their role in establishing a secure supply chain, provinces and territories will also be key partners in the federal government's efforts to raise public awareness about the risks associated with cannabis use. The government has indicated that it will monitor patterns and perceptions around cannabis use among Canadians, especially youth, through the Canadian Cannabis Survey. Such monitoring will serve to inform and refine further public education and awareness activities to mitigate the risks and harms of youth. We've covered how the government proposes to legalise and strictly regulate cannabis. However, this doesn't mean that in advancing this approach, the government is promoting the use of cannabis by any Canadian. It's recognised that illegal cannabis is widely available and frequently used by young Canadians, and that we must do a better job in providing relevant information about risks and disrupting the massive $7 billion illicit market. Tobacco and alcohol are both legal substances for which the government has implemented significant public education measures to address the harms and risks of their use. Similarly, the government is clearly committed to the implementation and ongoing investment into public education measures to inform all Canadians, young and old, of the risks of cannabis use. I'd now like to speak very briefly about the timing for the implementation of the proposed Cannabis Act. As some have suggested, that province and territories will not be ready, that law enforcement will not be ready, and that more time is needed. I would simply point out, honourable senators, that many experts take the opposite view, that there's a need to implement this legislation as soon as possible. The Canadian Public Health Association, in its testimony before the Standing Committee on Health, stated that unfortunately we don't have the luxury of time, as Canadians are already consuming cannabis at record levels. The individual and societal harms associated with cannabis use are already being felt every day. The proposed legislation and eventual regulation is our best attempt to minimise those harms and to protect the well-being of all Canadians. Honourable Senators, as we begin our study of Bill C-45, I'm greatly encouraged by the tremendous amount of work that has already been carried out in our provinces and territories. Many jurisdictions have committed to and completed consultations on how cannabis legalisation and regulations should be implemented in their jurisdictions. Ontario, Quebec, New Brunswick, Alberta, Newfoundland and Labrador, and the government of the Yukon have already released proposed legislation and/or frameworks describing how they will approach recreational cannabis. And Manitoba has enacted the Cannabis Harm Prevention Act. Late-breaking news just today is that the Northwest Territories released their framework. That's 8 provinces and territories. Clearly, many provinces are moving forward in anticipation of the July 2008 timeline. My home province, Canada's largest, will certainly be ready. And New Brunswick has identified cannabis production as a means of employment creation and economic diversification. The province has identified the cannabis industry as part of its economic growth plan. And we're all interested in economic growth, aren't we? In conclusion, it's important to note that the legalisation and strict regulation of cannabis has been on everyone's radar since December the 4th, 2015, when this commitment was highlighted in the speech from the throne that opened the first session of the 42nd Parliament of Canada, and as I have indicated today, for decades before that. I would point out to all honourable senators that public attitudes have shifted insofar as the legalisation and regulation of cannabis is concerned. While Canadians may not have been ready for such changes following the Ledane Commission in the 70s, most Canadians currently view the use of imprisonment and the imposition of criminal records for minor cannabis offences as heavy-handed. Canadians are supportive of the direction proposed in Bill C-45. Cannabis is harmful. Cannabis is easily available. And cannabis is frequently used by young Canadians today. It's time for us to stop looking the other way. I thank you in advance for the contributions that this chamber is about to make towards the study of Bill C-45. Thank you.